I'd like to welcome everyone to our series, or one of the events in our series of Summer Lunch and Learn series here with the City of Columbus Community Relations Commission. My name is Napoleon Bell, and I'm the Executive Director with the City of Columbus Community Relations Commission. So we'd like to welcome all of you to the program, and we'd like to welcome our panel to the program, and we'll introduce the panel shortly. But we want to make sure that we welcome all of you and hope that we have a lot of learning going on, a lot of information being gathered and given. We see that we have networking normally with our lunch and learns from 11 to 11:30, and we saw a lot of that going on. So that's some great things that are happening because we hope that people continue to network and continue to learn between yourselves, but also with our esteemed guests that we have here up on the panel. So for this particular series, we're going to be speaking on how the economy affects mental health. But first, let me just talk about real quickly, if you're not familiar with the Columbus Community Relations Commission, primarily our office is part of the mayor's office, and we work in particularly 4 different areas. First of all, civil rights. We enforce the Civil Rights Code for the City of Columbus, so if you're being discriminated against, we are the ones who can investigate that within the City of Columbus and enforce our Civil Rights Code. Also, with the New Americans Initiative, we have that initiative, which is one of the mayor's initiatives in which we work with the refugee and immigrant populations that are coming into the City of Columbus to help them have access to not only city services but county services, and also help them with networking to get them up on their feet as soon as possible. So if you want to hear more information about that, feel free to give our office. And matter of fact, our coordinator for the New Americans Initiative is Guadalupe Velasquez. Thirdly, we work in the areas of community empowerment. We want to be able to work with the community to be able to give presentations to them, to network folks just like yourselves, to be able to help them be able to empower themselves and the community to address issues and problems, but also grow all over the city. So we work in that area. And then last but not least, but not all-encompassing of what we do, is we work in the area of community, police, and fire relations, working with the community and dealing with issues and with police and or fire. And I'm sorry, one more thing, and a very important thing that we do is we work in diversity training with all of and diversity and cultural awareness training with all of the city employees, first of all, but then secondly with police and fire. And now also we're going out to the public and private entities to do that. So if any of you have businesses or work with one who want to have diversity and cultural awareness training within your organization, we'd be more than happy to do that for you. So please give us a call to do that. I do see, I got to make sure I introduce any of the staff that we have here. Again, there's Guadalupe Velasquez, who's in the back of the room, who's the New Americans Initiative Coordinator. We have Gail Gray, which I'm sure all of you know, who is on the committee who puts this all together and deals in our community empowerment. We have Neil Simmel over here, who is our diversity trainer and cultural awareness trainer, does all our diversity work. And I believe, let's see, do we have any other staff here? I'm sorry, there's Abdir Zakfera. Lord have mercy. Abdi Sope. Abdi Sope, he is actually the newest member of our team. He is our African Outreach Coordinator within the New Americans Initiative. Then also, if you didn't know about our commission, we have 23 volunteer commissioners. And with that, we have several of our commissioners that are here now. Also, we have Commissioner Takia Wright, who is here. I'd like to welcome her, and also Commissioner Angela Mingo. We have her here also. And then Commissioner Allison Poirier, who's going to be a part of the program, so you're going to meet her in just a moment. And also Commissioner Fran Frazier, who is going to be up here in just a moment also. So with that, we have several of our commissioners that are here, and we welcome them also. Last but not least, you do see CTV here. This is Channel 3. This is going to replay on Channel 3, so I encourage everyone to watch Channel 3 if you have Time Warner, I think, and also AT&T, I think it is, it's on Channel 99. But this will replay for about the next 6 weeks, and it'll also be live streaming on the web, so you can replay that or see that on the web and or watch it as it replays on Channel 3. So we're glad to have them here. So going into this, the economic crisis is expected to produce secondary mental health effects that may increase suicide and alcohol-related issues and or deaths. And so this is a very important topic that we really got to address because we're all experiencing the economic impact within our lives one way or another. So I'm glad to have all the panelists here. And at this point in time, I'm going to turn this over to one of our commissioners who is going to help moderate and facilitate, Commissioner Fran Frazier. If you come on up.
Hello. My name is Fran Frazier, and I'm a member of the Education Committee of our commission. Today's Lunch and Learn, as you've heard, is about how our economy affects our mental health. Right now, our unemployment rate in Central Ohio is about 8.1%. And the overall unemployment rate in Ohio right now is approximately 8.5%. Some things that you probably know is that the unemployment rates in the inner city of our neighborhoods is usually 2 times the city or county averages, specifically among African Americans, Hispanics, and new Americans, especially immigrants and people with limited English proficiency. COWIC, which is our premier job Leaders Program, is a one-stop operation, averages about 100 job seekers a day. And what they said was that 10,000 job seekers per year since 2007. And with an exception, I was told in 2009 when the unemployment rate spiked. And at one of their events, they had over 15,000 job seekers. So I just really wanted to kind of set the tone for why we think this particular topic is so important to us. COWIC has also noticed a trend in higher educated professional job seekers from the traditionally structurally unemployed. And here's what I think is real critical to our topic. They said that they've noticed a high level of stress among job seekers who come into their offices. So much so that they now partner with the Department of Public Health to provide health screenings right there, blood pressure, glucose, and as well as a social worker to deal with stress levels. Because what they say is that you can't be job ready if you're sick, but when you're unemployed, there are lots and lots of stressors. So you're always worried. And the other thing they said is that they've now partnered with Columbus Impact, who has a mobile health care unit, even for people who need physicals. So I guess the point that we're trying to make, just to kind of give you some basic information about this, is that unemployment is a stressor. Stressors affect behavior, behavior affects relationships, and it affects our mental health. So we're hoping that our panelists will give us some actual tools that we can use, and then hopefully our listeners and viewers can use to stay healthy while they are job seeking. I'd like to introduce to you our chair of the Education Committee of our commission, Commissioner Poirier, who will moderate our panel and introduce our panelists. Thank you very much.
Good afternoon, everyone, and thank you for coming. My name is Allison Poirier, and I am the chair of the Issues and Education Committee for the Community Relations Commission. I'd like to start out by, first off, thanking Nationwide Children's Hospital for bringing the snacks and the drinks in the back. And then secondly, I just want to jump right into this. So what I'm going to do is I'm going to real briefly allow our panelists to introduce themselves and from which organization they're from. Phil?
Yeah, I'm Phil Hedden. I work with the Adam H. Board of Franklin County. I'm the consumer and family advocate there. I wear many hats there. I pretty much oversee the client rights of the different AOD and mental health providers in the system. I do a lot of mediation with agencies and with consumers that are having issues with their agencies. And I also work with the Consumer and Family Advocacy Council at the Adam H. Board, which is really an integral part of our system to try to keep us focused as a board on why we're doing what we do. So they give us the perspective of consumer and family members and try to keep us kind of on task with our mission in serving the community and kind of assisting and shaping our programs in the community. So those are my basic duties at the Adam H. Board. And I share a lot of resources with folks out in the community. As resources right now are kind of limited, so I share the resources that I have access to with folks a lot of times in the community also that are calling.
My name is Jamoya Cox. I work with the Ohio Department of Mental Health. At the department, I work as the lead for cultural competence. As we go through the panel questions, I'll kind of spell out some of the things that I do in particular, but part of what I do is focus on workforce development, creating awareness around cultural sensitivity, awareness, promoting training internally and working with external partners to promote workforce development, also working with underserved communities as well. So as we go through the questions, I'll kind of outline in detail some what that includes and involves.
Thank you, Jamoya. Rochelle?
Good afternoon. My name is Rochelle Martin, and I'm the Executive Director of the National Alliance on Mental Illness of Franklin County. Our mission is to improve the lives of family members who have a loved one with a mental illness through education, advocacy, and promoting, helping them to understand this tremendous journey that they go through with their family members with a mental illness.
Wonderful. Thank you. Lisa?
My name is Lisa Callender, and I'm the director for the City of Columbus Employee Assistance Program. And an employee assistance program is a workplace-based program to support, educate, provide resources for counsel, and provide training for City of Columbus employees. So even though we work with a population, city employees and their family members who mostly have jobs, we're still seeing a higher number of employees who are experiencing stress and issues because of the climate that we are in today. And as other government agencies are, our people are our greatest resource, and so we're really the safety net for city employees.
Thank you, Lisa. Sherry?
I'm Sherry Unkefer with Nationwide Children's Hospital. I'm with the Family Violence Coalition, and for those of you who are not familiar with that coalition, we are the new entity or the new merger of what was formerly the Center for Child and Family Advocacy, which is the Child Advocacy Center in our area, and the Columbus Coalition Against Family Violence. We have merged those two organizations under our new title and are assuming services for family violence as in a more global, more comprehensive way. We are made up of various organizations across the county, including certainly Children's Hospital, Columbus Police Department, Franklin County Children's Services, the Office of the Prosecutor's Office for Franklin County, Choices. So we're all located together there across from the hospital. My comments today will be around family violence comments and pediatric behavioral health issues.
Great, thank you. Thank you, and welcome all. Welcome to the audience as well. As Lisa alluded to, you're seeing somewhat of an increase in folks presenting with some mental health issues. Let's start by talking about whether other agencies are seeing increases in those presenting with mental health issues and what we might attribute that to. Phil?
One of the issues that I think our whole system has encountered has been access issues to our providers, just due to the fact that there's such an overwhelming demand for services in our community. It's so important, I think, for us to counteract that with working together as a system, trying to do as much collaboration as possible with the agencies that we work with. I work pretty closely with Rochelle with NAMI Franklin County. We ship folks her way all the time, especially family members that might be at a loss to try to help their loved one receive services in the community. And Rochelle's group is able to help the family kind of understand what's going on and what resources are also available for the family. So there's a lot of folks that are lacking, not just the consumers in the system, but a lot of times family members in the system. And we try to help them move along and get the resources that are available out there. And I think just having the knowledge of the resources and talking and communicating with other folks in the system is going to go a long way. So.
All right, Jamoya, ODMH, are you guys seeing an increase in individuals seeking assistance?
I think so. One of the most important indicators is Medicaid. We've seen expenditures for community mental health services grow between 2005 and 2009 by 20%. That amounts to about $83 million. I'd say about 83% of that figure we can attribute to an increase in the number of Medicaid clients, and about 17% to monthly expenditures per client. So we are seeing more people come in and seek services.
Okay. Rochelle?
Well, I will agree with what Phil talked about in terms of access. Having access to services is a very progressive issue that is happening in our system. But I also want to say that I have seen a dramatic increase of parents calling from young men experiencing trauma, and the parents have no idea what they are going through. With the depression, with bipolar, they don't understand what bipolar, what schizophrenia, any of those mental health brain disorders are, and they are struggling tremendously. I hear mothers and fathers crying on the phone with me as to what to do. And so I provide them with the necessary issues to help them get through it. And these are young men in their early 20s that this is happening to. So it is a big, huge increase in our community.
Lisa, what about you?
Well, what I would add to that is, as the panelists have mentioned, the upside to better education and better information is that people are self-identifying more. So I think that's one of the factors as to why all of us are seeing increased numbers. Right. The challenge in that is that even for our folks who have insurance, it's challenging sometimes to get into a mental health provider. It's especially challenging to get into a psychiatrist if that's something that is indicated. It isn't for everybody. And we have insurance. Our folks have insurance. So we know then what is happening for folks who don't have insurance coverage. In the city workforce, we have a lot of people who are in that sandwich generation. They're dealing with raising their children. They're dealing with their job and the stressors that go along with that, and their own medical conditions maybe, or other issues that they're dealing with. They're dealing with their financial situations. And then they're dealing with aging parents and all of the things that go along with that. So it seems like that's one of the increases that we've seen in terms of the things that we're dealing with within the city of Columbus.
Okay, and Sherry, what's happening in the family?
Well, unfortunately, we're seeing some of the same trends. In a report that our medical director released in late 2009, he was able to show an increase in abusive head traumas of children from the previous year, from 24 to 43 cases. Child fatalities were up from 5 the year before to 12 the following year, and overall child abuse was being documented at an increase over an 18-month period of an increase of 41%. We had a demand for, just as our previous panelist indicated, we had a demand for pediatric behavioral health services from the program I manage alone. So one small program in Franklin County. We had an increased growth over a year of about 125 people more asking for services than the previous year. So we are certainly seeing trends in increasing rates of abuse and requests for services. I also think that child abuse has been impacted by access issues also. Now, a little different perhaps than what was noted previously, in that we saw the workforce in county caseworkers, so children's services investigative caseworkers, decrease. And so there were less cases that were being investigated less quickly, if you will. The process became less efficient, which left children in potentially abusive homes longer, which meant that potentially they were experiencing more abuse longer. And so you can see then the increase in fatalities, the increase in abusive head traumas, the overall increase in requests for services.
Interesting. What I'm going to do, 3 words came up that I found very interesting: access to services, collaborative efforts, and self-identifying. And with those 3, can we talk a little bit about what resources are out there, the ability to access them, and if we can't access them, how as a system are we now collaborating so that we are getting people where they need to be?
I'd definitely like to address that, because I think just the climate that we're in regarding the access issues has kind of forced us to seek collaborative ways of working together. I know NetCare on occasion, which is kind of our entry point into our system and our crisis agency, has had such a demand at times that we've had to actually come up with an agreement with the emergency rooms on occasion in the community, where maybe an overflow could be assessed and have some time there and a safe place to be while they're going through a crisis. The other collaborative things that we're doing, we're trying to have some faith-based initiatives where we're working with the faith-based community on trying to work together a little more closely because of the limited resources that we have. So that is another area that we're trying to develop a stronger relationship with, is a faith-based community. Those are some things. The other thing I definitely need to say is Mental Health America, an agency that shares a lot of resources and has a lot of information about resources in the community. They have a pro bono counseling program now for folks that might be in between jobs. It's kind of a short-based counseling program, maybe 8 to 12 sessions, time limited, but it's for the folks that kind of fall between the cracks. And there's a lot of folks out there, a lot of first-time users of mental health services that never have even been in our system due to the climate that we're in now. So that is a very good resources for those type of folks that have kind of not even been able to access services, period, probably in the past. So I think that's another real good resource that we have in our system through Mental Health America with a pro bono counseling. The other resource, Juliet out there, who works with the Peer Center, which is a consumer-operated program in our system of care. You know, I've referred a lot of folks that have kind of maybe in the wait mode for services, suggested that they go down to the Peer Center and spend some time down there and receive some support and some, just some friendship and support and maybe some help in getting through to that point until they can access services. So, I think those are the kind of things we have to be aware of, and we all need to work together in that fashion, I think, so people can get their needs met.
I would echo what Phil's saying, that I think it's, in this climate, it requires us to really think outside the box. And not everything requires a licensed mental health clinician, and we really have to think about other resources that all of us use every day. And I appreciate that you brought up peers, because I was thinking that I wanted to make sure we mentioned that. We have folks that we know within our city system who've used EAP, or maybe they've been through a difficult time and they've overcome that, and they've said to us, you know, if you have another city employee that's hurting with this particular situation, have them call me. I'm happy to talk with them. And that is so, so helpful, because when we're in the middle of a situation or a crisis, we often think we're the only ones who've ever been through that. And in reality, we're not. There are many people who've been through that. So there's lots of bridges out there that is important for us to look at. Clergy is another one that you brought up that we absolutely want to reinforce with folks who are tied into a faith community. And really just the question of what support systems do you have in your life? Most people can think of one person. If they can't, then we've got to really help them a lot, dig that up. But who in your life is a support person for you, or who do you work with that models a healthy life that maybe you could go to lunch with and talk to about this situation?
What I would like to add is I echo what Phil said about the services, the collaborations, but in addition to it, Mental Health of America has Neil Edgar, who is our mental health ombudsman. And you can pick up the phone and call him, and he will work with you to figure out a way to get the person connected to services. In addition to that there is an organization called the Human Services Chamber, and there are 76 to maybe 80 not-for-profit folks that come together. And a number of us come together and we are a member of that big collaboration. And we can pick up the phone and call each other and work through issues that we may have that will help the people in our community. So I just wanted to add that. And also, I really work very hard at thinking outside of the box to get to what needs to be done to help people struggling with mental illness. You really have to take the time and really think through and figure it all out.
Jamoya, Sherry, any thoughts?
Yeah, just to kind of build on what was said, we do have what we call our toll-free bridge at the Department of Mental Health, and it's supported by staff that actually understands what it means to experience illness and know where resources is to help people that may be calling in. It's a number, and I'm going to say this is for the viewers. It's 877-275-6364. And anyone calling from anywhere in the state could basically call into this number. And what they'll do is they'll let the individuals know who their individual board is, who will then connect them to community support services. We're really happy with that resource. Also, two organizations that the department funds. One is the Ohio Suicide Prevention Foundation, and it's a huge, huge resource for adults that may be experiencing anxiety and depression as a result of the economy. And also Red Flags, and that's an organization that really supports youth that may also be experiencing anxiety as well. So we have several organizations that really are available to support the community.
Thank you, Sherry. I'm going to interrupt 1 second. I'd like to acknowledge and thank our chair of the commission, Chair Mary Howard, for attending. So thank you very much. Go ahead, Sherry.
Access to care is an extremely complicated issue. Part of the answer, of course, is responsible treatment. So it's one thing to link families into counseling or a clinician. It's another thing to provide them with care that is efficient and effective. And I believe that, at least again in the child-serving world, our authority agencies and our funding agencies, so entities such as Franklin County Children's Services, the Juvenile Court, Adam, they have really done a very nice job of holding providers a little to the fire lately. They fund programs that have evidence support behind them. So it's a different world now that, you know, the clinician doing what they think feels right is no longer justification to do treatment. And they really have created situations where if you can't prove that what you're doing is effective and efficient, then they're not going to pay you to do it. I think it's an interesting way to think about collaboration. I think it's a very powerful way to think about collaboration, and it's nice to see our county being very smart about who they're willing to continue to fund.
Okay.
Can I just add one thing on
Sure,
to
Phil.
Rochelle? Just kind of, Neil Edgar, great resource with Mental Health America, the ombudsman that Rochelle referred to, and his number is 242-4357. I know it by heart because I work so closely with him also. We share a lot of cases. We share information when we have the chance to and when we have the permission to work together so somebody can receive the best outcome that they can. And he is just a wealth of resources.
Okay, you said Neil Edgar.
Neil Edgar, 242-4357.
Great, just for the viewing audience. Let's, okay, we've talked a little bit about resources. We're seeing an increase in folks. From each of your individual perspectives, who would you identify at this point? What populations are you seeing to be most at-risk populations? Age-wise, gender-wise, whatever. Okay, go ahead.
For us, we are seeing young adults. That age group between 18 to 24 years of age. They are highly at risk. They are experiencing warning signs and symptoms, and they are self-medicating. So that is a serious issue for us and their families.
Thank you. Anyone else?
I would add on to what I mentioned earlier about the sandwich generation, people in their 40s, 50s, 60s who are dealing with young adults who are going through this, or smaller children, their own things, and then dealing with elderly parents. And there's just no rest. There's no period in a week where there's rest. And the whole purpose behind the word recreation, relaxation, is that we get some time out and that we recreate. But when your plate is overflowing, there's no time for that. So that's a group that we're trying to help in some various ways.
Without being too obvious, of course, when you talk about family violence, the population has stayed the same. Women and children are at the greatest risk, and they continue to be. We also have begun to understand, though, really the different types of family violence and the way that it impacts families. So there's actually very good information out there now that says, families where there's domestic violence, those families at the highest income levels have the highest rates of child physical abuse in their families. And so when we start to talk about the economy and people who have been impacted by the downturn, in some ways somebody could argue, those who have the most to lose have the most to lose. And so we have to, I think, continue to be informed about what the different types of family violence are and what type of families are most likely to see certain indications. And so thinking broadly about the different populations and understanding what the stressors are as it relates to the economy.
Sherry Jamoya?
I'd like to just build on what was just said. I think when you think about who's at risk, we know that poverty is one of those things that researchers tend to link mental health and mental health issues with that particular thing. With so many people losing jobs, just to throw out some figures here, about 650,000 jobs lost between 2000 and 2010. Approximately 62,000 of those jobs reported lost at the end of the recession. We do know that many people may be able to get jobs, after losing them, but a great percentage of these individuals probably will not. And just gauging about what we know about disparities, that minorities are impacted at a higher proportion with respect to poverty, with respect to economic status, with respect to education and all of those things. So I'd like to say that in many ways minorities are probably at risk. And when you look at the other things such as, when you have to consider actually increasing foreclosures, loss of investments, those kinds of things, they just, increase that risk of that individuals might engage the system. So,
Phil, any comments?
I think just to kind of add to what I've said before, we've seen more first-time users in our system that have never experienced mental health concerns in the past until recently, and I think a lot of it's due to the climate that we're in presently. A lot of folks are depressed as a result of their situation, and I've never had to use our services in the past, so we're seeing a lot of first-time users, not only that have been referred to Mental Health America for the pro bono counseling program, but that have actually experienced hospitalization for the first time ever. So people going through some pretty traumatic experiences in their life, and I think those folks are at risk.
Okay. I think those individuals, you had mentioned that they're coming through Mental Health America or hospitals. I wonder if we could identify, are those people self-identifying as mental health issues, or are they ending up in services or hospitalized and then seeking services? Because we had talked about folks self-identifying, and I was just wondering if you had any. No? Okay.
could you repeat your question again? I may be able to answer that.
Well, we had talked about self-identifying. So are these first-time individuals, are they coming to our agencies via a referral process from another agency, or are they actually presenting themselves at the front door, self-identifying with mental health issues and saying, I need some assistance? I was just wondering.
I think what we're seeing is many people engaging the system through emergency services. Many people, because of stigma, aren't really addressing the symptoms, and because of that, they're going to an ER or are going to Netcare and actually entering the system through emergency services. And kind of one of our goals is to kind of reduce that by really increasing awareness. And as individuals come through to obtain emergency services, really connecting them to good support services within the community.
I would add that I think that
Go ahead, Lisa.
excuse me.
It's okay.
Sometimes it requires a peer or a family member to either gently nudge or strongly nudge or
Right.
be even more forceful about it to get a person through the door, because it's so difficult that first time to ask for help. There's still so much stigma involved with these kinds of issues that for us, for a certain percentage of folks coming to us for assistance, it's because a friend has said to them, you seem like you're going through a really hard time, or you're way grouchier than usual. What's going on with you? Maybe you want to go talk to those folks over there, or it's been a spouse or a significant other saying that. But, most of us try to handle things ourselves, and a lot of times we think we're handling things, but people around us can really see that we're not, and we found that's really what gets folks to us many times.
Rochelle, did you have a comment?
Yes, and the comment that I would like to make is the family members are trying to get these folks through to go for the services that they need, and it's very difficult. They resist the family member trying to tell them that there is something wrong and that they need to go and seek care. It's real tough.
Can we talk a little bit about, as an employer, a loved one, a coworker, a friend, a family member, and family members, and we're all trying to assist and get folks to services. What are some of the warning signs? If I'm not familiar with mental health, I'm not really sure what I'm to be looking for, what might you guys suggest as professionals to our viewing audience? What are some of the warning signs? What might I be looking for?
Well, I can say for children, you may see drops in grades, and even difficulty in raising those grades after trying, increased irritability, anxiety, you may disobedience, those kinds of things, and definitely more aggressive behavior.
Well, I actually brought with me warning signs that I put at the back of the table. And these warning signs are located on Mental Health of America's website. And I would like to go through the ones for adults. Confused thinking, prolonged depression, sadness, or irritability, feelings of extreme highs and lows, excessive fears, worries, anxieties, and that goes with people who are unemployed, social withdrawal, dramatic changes in eating and sleeping habits, strong feelings of anger, delusion, and growing inability to cope with daily problems and activities, suicidal thoughts, denial of obvious problems. Those are just to name a few. I have lists in the back.
Okay. And for our viewing audience, if they're interested in that list and they're not here today, you said they can get that at the Mental Health America website?
That's correct.
Okay, thank you. All right. Anybody else?
It's brief, certainly with regard to family violence, actual physical injury. So bruises, injuries, scrapes, loss of hair, those pieces, if you're seeing them, ask.
And I think just, again, to add on to what everybody else has said, that it's important to trust our gut feelings. If you have somebody in your life and they just don't seem like themselves, check it out with them, reach out to them. Doesn't mean we're diagnosing them with a mental health disorder, because they may or may not have that. They may just be going through a tough time, and it's really okay to say, I care about you, I'm concerned about you, what's going on? That may be the bridge that they need to getting some other kinds of help that would help them.
May I add just one more thing?
Please.
For young adults, we're seeing substance abuse. So they are doing some self-medicating. So that's real crucial.
Okay. And I was going to ask Rochelle, in terms of, we talk about self-medicating, I'm very familiar with what self-medicating is. The viewing audience may not be, and that is a warning sign, but could you expand on that just a little bit so everybody knows what we're talking about?
Okay, thank you. Using substances, alcohol, drugs, illegal drugs, marijuana, crack cocaine, sniffing and snorting of things that you have and that you use for cleaning things. Those are things that are used.
Okay.
Does that help?
Yes, it does. Thank you. Thank you. Phil, do you have anything?
No.
No? Okay. In terms of, and I think, Jamoy, I'm going to start with you on this one. How is your agency assuring that when we provide mental health services to people, that they are culturally competent, and with the diversity we now have in the city of Columbus, that we are educating and reaching all of the arms of our communities?
Well, I think we're doing that in a number of ways. For example, this month is B.B. Moore Campbell National Minority Mental Health Awareness Month. Next week we'll be holding a panel discussion where consumers will be participating and sharing their perspective on what they believe is necessary for providers to actually provide culturally linguistically appropriate services. Internally, we also have a program called Cultural Social Interaction Study Circles that really focuses on promoting cultural awareness, looking at disparities, looking at how minorities are disproportionately impacted by unemployment, lower education, housing, all of those key areas, some of those things, so that we can have a better picture of kind of a little bit more about the background of consumers being within the state of Ohio. So workforce development internally is huge. Externally, we fund the Multi-Ethnic Advocates for Cultural Competence. They do a very good job at promoting regional training around cultural competence. They actually have a conference coming up, and I'm just going to read what it's called. Informing Cultural Competence Through Research and Best Practices, Eliminating Disparities Across Systems. And that conference is going to be September 28th through the 30th. So please register for that if you already haven't. So we're doing a number of things internally and externally to promote cultural competence, to promote the reduction of disparities and create awareness around other cultures.
Okay, 2 questions. So if I wanted to register, would I go to your website to do?
You would go to MAC's website,
MAC?
which is www.macinc.net.
Okay. And then you also mentioned you were going to have a a consumer-based group to sit down and identify what they need and are looking for in their communities. Did you say something like that?
It's going to be a panel discussion
Okay,
that we're promoting internally with staff.
Oh, it's internal.
Yes,
Okay.
yes.
Okay. Great. Thank you.
We have a very strong Consumer and Family Advocacy Council at the board. And I would say that, is a very good group for folks of any background to be involved with if they want to try to make a difference within our system of care, and also want to provide some input and perspective to our system of care. So I would say that's a good group, and you should be able to access the information for CFAC. We abbreviate it CFAC on our website. And I also brought some brochures back there regarding CFAC and some schedules also. And I would invite anybody to attend that meeting. It's an open meeting. We have a lot of consumer and family members that attend that meeting. And it's a good group of folks. And I know a lot of our providers have written literature and documents that are translated in Somali and Spanish. So I know that's another way that we try to address those issues. And we have, I think, interpreter services through Chris and us together. So those are some of the ways that we try to incorporate.
Rochelle, any comments?
Well, NAMI Franklin County has started by first training teachers to African American and Hispanic folks to become teachers of our family-to-family classes. And those classes are provided, those trainings are provided by teachers that have a child or loved one with a mental illness. And so we have increased our African American and Hispanic teachers for the first time. We now go all over Franklin County to provide our services. We are no longer located in just one area of Columbus. We travel all over. As well as nationally, we, NAMI Ohio and NAMI Franklin County, as well as NAMI Cleveland and NAMI Cincinnati, are a member of a committee where we're looking at increasing, going out and making sure that everyone gets our services. So we are reaching out into the communities. So we are actually having a big training in August to introduce that to all 88 affiliates of NAMI services around the state. So that's wonderful for us.
Lisa, Sherry, any comments?
I just think I think finding the right fit or the right match to the professional that you're talking to is really important. So we appreciate the work that you all are doing so that when we do refer an employee of ours to a provider, that we've got a good pool to work from that is going to be a match for them so they will feel comfortable.
And just to add a few more things, one of the things that we do as well is each of the boards produce a community plan, and in it there's a cultural competence component. And typically, we actually work with them to kind of address any issues, any technical assistance issues that they may have within those plans. We try to coordinate support and TA internally and through our external partners to assist board areas as well. We also partner with organizations from different communities, be it the Somali community, the Asian American community. We've done that over the years, and by partnering with MAC, we've actually sponsored the development of several needs assessments to really look at gaps and barriers in services. Those tools are available on MAC's website, just so that clinicians, service providers can learn a little bit more about how that culture actually sees or looks at mental illness. And actually look at what's needed to better support each of those populations.
And Ms. Sherry, I'm anxious to hear your response to this.
So certainly cultural issues, including gender, are very significant in family violence. There's disagreement about what family violence and domestic violence is across cultures and within cultures. Who endorses the acts as violence? Who endorses the act as marital relationships? And so we spend a great deal of time trying to understand what it means for the individuals that we're working with. The intergenerational aspects of child abuse are also a critical cultural issue for us. Most of the mothers of the children that we are treating for sexual abuse have been sexually abused themselves in childhood. As are most of the fathers. We simply have more mothers that present with their children than fathers. And so understanding culture not only broadly but deeply. The work of Commissioner Frazier and the recent release of some of the media around understanding trauma experience in our young African American females has been critical to making us aware that these are real issues that we have to deal with, and depending on who you are, what your experiences are make you different than the person that's sitting next to you. So we spend a lot of time talking about what does this mean in context to who you are, the family you grew up in, and the community that you grew up in. I also brought some literature. Of course, it's the probably famous green cards of the Columbus Coalition Against Family Violence. We have them in English, in Somalian, and in Spanish. There are some in the back of the room. If people watching the program would like the cards, they can call 722-8200 and request them. And they're resource cards of services that are available in the community.
And we're going to open it up to the audience for questions. Anything that I didn't ask or piecemeal together that you guys would like to say?
Well, I try to look at this period of time that we're going through also as an opportunity for growth and an opportunity for the consumer and family members to have more input and to be more of a centerpiece of our system of care. And a lot of times when I'm speaking with folks, I'll share information about our consumer and family group and offer for them to attend and be at the table and be part of our system and to maybe help us work through some of these issues that we go through. So I try to frame it sometimes, as an opportunity to be more at center stage and to be more of an integral part of our system of care. So I think sometimes you almost have to have that perspective too, to give folks hope and to help empower them. And, I think that goes a long way sometimes.
Anyone else?
Certainly, you have to applaud hope and the instilling of hope. So I think it's a tremendous point. Not to be too obvious, but while we certainly understand, issues such as a downturned economy, issues such as, blazing heat, and the impact it has on us as individuals. I would be remiss if I didn't make a statement that said, but we absolutely don't believe that these issues are causal to individuals who batter and abuse their children. Do they contribute to frustration? Do they contribute to stress? Certainly they do, just as they do for us. I'm not in as good a mood today as I was, when it was a little cooler out. So that's true. It doesn't cause someone to harm another individual, and so be really clear about responsibility.
Anyone else? No? Okay, at this time, I think we'll open it up to the audience if you have any questions. And because we're on television, I apologize, but you do have to come up to the podium. And for anybody who does have questions, so that we don't interfere with the camera, if we could kind of head over this way, that would be great. Yep, thank you so much. Go ahead. Just introduce yourself and go ahead with your question, please.
I'm Laura Thielbar. I'm on the ADAM board of Franklin County, and I'm also involved in the Consumer and Family Advocacy Panel that Phil mentioned. I'm a part of the Suicide Prevention Coalition since my son died by suicide. I am a volunteer extraordinaire. And the question that I have is, I love hearing about all this information. This was a really good panel. But what I would like to find out is how we can get better access to this information. And I see that all of you are trying, but I would like to see a website with all of your information on instead of having to go to all of your sites. Because, say, like if you're in a crisis with your family member, you don't have time to do all this hunting and you don't know of the information. So if anybody has any response.
It's a good idea.
It's a good idea. Yeah, it is a good idea.
Oh, DMH.
And I apologize for running, I was looking for it, and Mr. Phil has one right here. We have a street card, and for the viewing audience, again, this is on the Columbus Coalition for the Homeless. It's on their website. It is printable, or I'm sure you can call any of these agencies, and we'll give you phone numbers at the end.
Also might be helpful. And the Consumer and Family Advocacy Council pretty much heads that up, keeps an eye on things.
Okay.
That's another real good resources solutions page.
So, Phil, can I just say this for the viewing audience? If they're interested in obtaining these materials, can they call you and you can?
Sure, and I brought a bunch of materials in the back too on the table.
Okay.
And these are two of the documents that I brought.
So
just
for
two
those
of
in
them.
the audience, those are available. For those in the viewing audience, at the end, we'll give you some phone numbers, and you can contact any of these panelists and get that information. Next question, sir? Thank you.
Hi, Sean Becker, Furniture Bank of Central Ohio. First, I have a couple of comments, followed up by a question. First of all, to the panel and the City of Columbus Community Relations Commission. One of the things that we heard was the stigma attached with seeking help for mental challenges, and having a panel discussion like this hopefully will work to removing that stigma and making it a little easier for the people that need the help to take that step and go get it. My comment is, or actually one other comment is, we're working for a nonprofit organization such as the Furniture Bank. We see lots of people come to us looking for employment. Some people are looking to us as a volunteer opportunity, and I know nonprofits around Columbus and certainly all over the place are looking for volunteer assistance. We're happy to engage volunteers, and it might be an opportunity for some people who are struggling to find employment to reach out and help organizations like ours or others around town It will show them that they can still contribute, maybe in ways that they weren't aware of. If the panel could address some of the efforts that your organizations have made to maybe reach out and encourage that kind of activity, particularly for those people who, I think Phil, you mentioned, or someone mentioned, for those people that don't have that one person in their life that they can look to. In addition to your organizations, there are other organizations out there that can help build a network for folks. So I'll let you address that. Thanks for your time.
Well, as I mentioned before, the Peer Center, I really rely on them a lot for folks that need support at times where they don't have any support maybe. And I would view the Peer Center as kind of being an extended family. And I'm sure Juliet would probably agree with me. A lot of folks that attend the Peer Center might not have that support that they need, might not have that one person that they can speak with. So I've been down there to visit. It's a nice atmosphere for folks to go down and visit and just feel support and friendship. And I think that's a very good resource that we have in our community, and I refer a lot of folks there. We also have an agency within our system of care called COVA, the Center of Vocational Alternatives. That's a very good resource for folks that maybe are seeking employment, maybe need an assistance as far as job coaching even, or job development to get the job. Some people are good at getting jobs, they just can't keep their jobs, so they might need the job coaching piece. So they can provide both of those resources for folks. Also, it can be an opportunity for them maybe to work on their resume or to work on their skills, whatever skills it might be that they need to improve on. So that's another real good resource for folks, I think, is COVA. And their number is 294-7117. And they have orientation on Tuesdays and Thursdays for folks at 1:30, and Barb Schmitzer is the contact person down there for the orientation. So those are two real good resources that I can think of.
Great.
I'd say from the state, a very good resource is the Ohio Empowerment Coalition. They were really founded, I believe this is the second year that they've been in existence, but they're a statewide organization, consumer organization. And one component of consumer advocacy that they address would be employment, and as well as many other issues. Anyone interested in getting the Ohio Empowerment Coalition's contact information, see me after this event.
Okay, great.
Well, NAMI Franklin County we always need a number of volunteers because we put on the NAMI Walk every year, and so we always are looking for folks to come out and help us be successful at our walk. And the money that we get from the walk, we actually use to promote our programs, to make sure people can access our services and get the resources that they need to help them get through this tough journey that they are going through with their family members. So, of course, I can be contacted, or you can call NAMI Franklin County at area code 614-501-6264.
Okay, and actually, Phil had mentioned the Peer Center, and we're lucky enough. We have one more question?
Yeah, let's go.
Okay, one more question.
No, we're good. I just want to jump in here before we went into that. And then listening to this, I've got a question. We talked about the warning signs and those things going on, and then what you can do after that. But being one of those persons who are in my 40s or so, and having kids, and then having parents aging, what do you recommend though to those persons who aren't suffering mental illness at that time? But so what are the not warning signs, but what can they do to stay healthy and not go over that edge, to that point of where they need that assistance? What are your recommendations? Say, you're going through some stressors, but you're not at a point where you're over the edge. But here are some things that you should do periodically or throughout your life to keep yourself balanced?
I'll speak to that. You know, we often remind people of some of the very basic common sense things that we all forget about when we're stretched too thin. Are you getting any kind of physical exercise? You don't have to be running marathons, but are you walking? Are you doing something a couple of times a week where you're just getting out and moving? We know exercise has a tremendous benefit to help to manage stress. Are you watching your alcohol consumption? Again, another one of those things that drinking's not a bad thing for many people, but sometimes people can escalate that and not know that. So watch that. What's your rest like? If you're not sleeping well because you're so stressed out, are you at least trying to take a nap if you can? Are you at least trying to lay down and have some quiet time? So, you know, the exercise, the rest, watching alcohol intake, what's your diet like? Are you eating a healthy diet? Again, the common sense things that often we forget about when we're under stress are a lot of the things that we remind people about.
And I would like to add, all of those things that Lisa brought up is very important. But in addition to journaling, writing down what's going on helps relieve the stress as well. And I always tell my parents to think about that, you know.
Just to add on to that, a good social network, a support system, be it a place of faith, family, those things tend to help as well.
And I can't probably leave the panel without saying the word resilience at least once. So all of the things that we're talking about really help us all be more resilient and have a stronger foundation so that when we have these things happening in our lives, we're going to be able to roll with it and not take as heavy a hit. So I'll say it again, resilience. We all need to improve our resilience.
And for parents whose children have been abused, we know that the existence of one safe adult who nurtures you and loves you makes all the difference in the world. And so, you know, back to hope, to Phil's, you know, don't give up hope. If you're a parent of a child, being there, loving them, being present for them, listening to them, really does make a difference.
Thank you.
Thank you. And before we move on, I'd like to acknowledge Commissioner Jindal, who has joined us in the audience, so thank you so much. Juliet is from the Peer Center that Phil has been talking about, and we are lucky enough to have her in the audience, and she's agreed to come up and talk with us a little bit about the Peer Center and what they do. Thank you.
Good afternoon. I'm Juliet Doris Williams. I'm a person who has struggled, has a lifelong journey with depression. I'm also a child and adult abuse trauma survivor. I'm also the executive director of the Peer Center, which is a couple blocks down the street, 1221 East Broad Street, and also at 15 West 5th, just off High Street. We just expanded to a second location. And with all the words that have been, the two words that I want to speak to, hope and stigma. I'm a walking hope engendered person and a walking stigma buster, because the only people that we hire at the Peer Center are people like me, people struggling some journey with mental illness, addiction, or trauma. Some of us, sometimes all three, or some variation of the three. And that's all of the staff for the people that walk through the door, who are people who have mental illness, are in addiction recovery, or are trauma survivors. And that's what we do. Every day of the year, we are open. And if you go to our website, which is www.thepeercenter.org, you can find our activities, our calendar of activities, and all the things that we do, our hours of operation, all of that. And yeah, it is about hope. It is absolutely about hope. And just because you have a mental illness, and just because you are in recovery from addiction, and just because you have experienced childhood and adult trauma, trauma is sexual violence, sexual abuse, domestic violence, you name it, there's a long list. That's not the end of your story. That's not even the beginning of your story. That's not the story. It's about hope. Thank you.
All right, do we have any more questions from the audience? Yes, we do. Thank you.
Hi, everybody. I'm Gail Gray with the Community Relations Commission, and I am the Community Outreach Coordinator. And I just wanted to share with everybody here and the audience at home that one of the things that the Community Relations Commission does is we ease neighborhood tensions. And sometimes with the economy the way that it is, and also with the heat the way that it is, things begin heating up in neighborhoods. So if there's issues between neighbor to neighbor or community to community, please feel free to give us a call at 645-1993.
Thank you, Gail. That was a very good reminder. Do we have any more questions? No. Okay, at this point, what I'm going to do is I'm going to ask the panel, starting with Phil, to go down the line and again, one more time, say our name, who we're with, and our telephone number so that folks in the audience, as well those who are viewing us on television, have the ability to contact us. I will remind you, this show will replay throughout the next 6 weeks, but if we could start with Phil, that would be great.
My name is Phil Hedden. I'm with the Adam H. Board of Franklin County. I'm the Consumer and Family Advocate there. And the number where I can be reached is 224-1057. That's 224-1057. Thank you.
My name is Jamoya Cox. I'm the Cultural Competence Lead at the Ohio Department of Mental Health. I can be reached at 614-728-5687. Again, that's 614-728-5687.
I'm Rochelle Martin, Executive Director of the National Alliance on Mental Illness of Franklin County. I can be reached at area code 614-501-6264. Again, the phone number is area code 614-501-6264. And remember, recovery is possible. Please remember that recovery is possible. Thank you.
And I'm Lisa Callender, and I'm with the City of Columbus Employee Assistance Program, or EAP. And again, we are a support program for City of Columbus employees and significant others. So if we can help you to be healthier and weller, we want to do that. We are at 645-6894. And again, that's 645-6894.
And I'm Sherry Unkefer with the Family Violence Coalition at Nationwide Children's Hospital. Our number is 614-722-8200. 614-722-8200.
Great. Thank you all so much. And I'm going to have Commissioner Frazier come back to the podium.
Thank you. Really want to thank the panel for today. It was incredibly informative. Lots of resources. We really, really appreciate it. And we appreciate our audience who is here today at our Lunch and Learn. And we thank our viewing audience as well. Certainly, we also want to thank Nationwide Children's for the snacks they provided and the drinks. How the economy affects mental health. That's what we talked about today. And I hope our viewing audience had an opportunity to write down some of those numbers. There is a toll-free bridge at the Ohio Department of Mental Health. I did take that number down, 877-275-6364. Neil Edgar at Mental Health America, 242-4357. COVA, 294-7117, and the Empowerment Coalition, and MACC, MACC.Inc., especially about the conference that's coming up, the Ohio Suicide Prevention Foundation, and Red Flags, which is a great program for youth. And I think there is one message that I'd like to leave you with that Phil gave us, that this is an opportunity for growth. That regardless of what's going on, there is a way to, as the panel has said, think outside the box. So I leave that with you. For more information on our Lunch and Learns series, or if you want to connect with the Community Relations Commission and our services, I would ask you to go to www.crc.columbus.gov, or certainly give us a call at 645-1993. Thank you very much.